There have been several developments since the last edition of Neurovascular Neuropsychology in 2009. Probably the most important advancement is in imaging of the brain. We can now see connections between the brain that we didn't even know existed before. We could also see how different parts of the brain work together in ways that we never saw before. And through that understanding, we have developed better diagnostic modalities, better ways of trying to understand what is wrong with the brain, and it's given us the opportunity to do an intervention that is based on how we think the brain actually works. So with that opportunity, we can now do more things for patients than we ever did before. Neuropsychology has the mandate to be able to not only establish principles about brain function, but to be able to produce principles and guidelines for things that happen to people in their everyday lives. So we want to be able to predict who's going to have a bad outcome after surgery. If a patient has to participate in a clinical trial, for example, for a new drug or for a new device, there's new awareness now that the impact on cognition is very important. So neuropsychologists have become intimately involved with other disciplines in clinical trials in order to make sure that there is not an adverse effect on a function that people consider very important. There are a variety of areas of research that need to be done. In neuropsychology specifically, we have now a multi-diverse population. And the judgment that we have to make is whether this person is normal or abnormal. Well, what's our standard? And that's a question that has to be resolved in an environment where the standards could vary from block to block. So we have to learn better how to interpret it, not only because people come from different cultures, they speak different languages, and it's up to us to make a determination of whether or not there's something right or wrong with the brain. So that's a very important area of research. We also have to make sure that we take our science and make it relevant to the community, so that when we come up with a diagnosis, it has some meaningfulness and we can formulate a treatment plan that will help improve the function.